Good day, viewers. This is Insight with Peaceful Pace. I did a series on mental health and well-being, and today I want to round it up by bringing to our awareness ways that we can be supported if we are experiencing this or our loved one is experiencing this. I looked at NHS England, Department of Health. I also look at the Department of Health Australia, and they all have similar ways which people can be supported if they are going through this. I will start with psychosocial support. Psychosocial support simply means being connected to your environment. The psych, which is the individual, and the social, which is the environment that they live in. So when someone is going through this, staying connected to the available resources, to people that can help them is very important. These people will help them develop their resilience and their ability to cope with stress. You can speak to your teachers, you can speak to your doctors, you can speak to faith leaders and friends. Being in a social network that is supportive is very helpful when it comes to that. So psychosocial support is very important. It helps develop our resilience, it helps us stay connected, and it just provides the support that one needs. Somebody to talk to when they are done, somebody to help them seek the available help within the environment. That's very helpful. Again, they looked at avoiding the use of illicit substance. Things like alcohol, things like drugs sometimes trigger mental illness. It only makes the already bad situation worse. Some people, their first episode of psychosis is being triggered by the use of drugs, hard drugs, cocaine, even cannabis when it's overused, or for some people it just have negative impact on their mental health. So avoiding these illicit drugs and substances can help someone stay healthy. The third factor they looked at is self-management. A lot of people, due to everything they've been through, less privilege, the environment, the abuse and all of that, lost their ability to deal with stress. And sometimes developing your resilience by equipping yourself and understanding your individuality does help. So when you know, you begin to think weird. When you know you are not able to do the things that you normally would do, that's when to start looking for help. And most times it's good not to wait till such a point. Just know that to be healthy, you have to be on the preventive side than being curative. So how do you do that? Eat healthy, do exercise, stay connected, be occupied. Your occupation, sometimes when we are engaged in doing something that is meaningful and purposeful, we get distracted, we become hopeful, because hopefulness is very important when it comes to mental health. So understanding yourself is very important. Developing self-management skills is very important. Moving forward, we look at the psychological therapies that are available. Most times, the way people perceive and think about things, those affect them. You look at mental illness like panic attack, you look at anxiety, you look at so many of these things. Some of them have their root causes as the way they think. So psychological therapy to deal with abuse, to deal with the way people think about things that have happened to them or they are going through will help. These therapies will deal with the cognition, the way people think and remember things, and how to deal with them in their behavior. So how they relate with these things. Psychological therapy is very helpful. Then you look at now medication, because mental illness is so wide. There are different medications that can be prescribed for the individual. Anxiety might have their different one and different dosage. Same medication can be used to treat different mental illnesses, but the dosage might vary. So there is help. Medication is very helpful. They will look at what is useful and what will be helpful to treat a particular condition. So please, after all said and done, psychological, economical, social, in all of these, the factors that could lead to mental illness, there is treatment. If you are going through this, don't give up. Go for treatment. Until next time, I will end up by saying, stay positive, there is hope. Keep thinking positive. Until next time with Peaceful Pace. Bye for now.